Hi, my name's Joanna Craven. I am an ST3 Trauma and Orthopedic registrar working in Cheshire and Mersey. A bit about myself, so I went to Newcastle University where I did a 5-year degree, and then I came back to the Northwest, which is where I'm from, for foundation core training and then for my higher surgical training. Career pathway, so I've known pretty early on that I wanted to do orthopaedics. So I originally thought I might quite like to do sports medicine in about my 4th year of medical school. So I spent some student selected components and my elective in sports medicine, and through that I ended up in orthopaedic theatres and felt that that was more for me. I am currently 27. I have gone straight through without any years out so far. So my chosen specialty, what does it involve? So I'd say that trauma and orthopedics is a really varied specialty. So we work in major trauma centres, we work in paediatric units, we work in district general hospitals, and the work is quite varied. So we'll have clinics which include both elective patients with more chronic conditions, fracture clinics where we see people following injury. We attend theatres again on a trauma basis or for elective procedures such as arthroplasty. We also have inpatients on the ward, and so there's a little bit of ward work involved as well. And during on calls you spend time in A&E supporting juniors. We see young and old, we see people with really serious and more minor conditions, and so I'd say that the working week and also the caseload is relatively varied. What are the benefits to orthopaedics? I think that orthopaedics is, as I've just alluded to, really varied, and for me that's a massive pro. It keeps you excited, there's lots to learn, there's lots of subspecialties within orthopaedics that you can really focus on. There's lots of opportunity in research, in audit. We have several big conferences and meetings which you can involve yourself in. There's definitely new and emerging technologies in terms of implants. There's robots coming in for arthroplasty. There's artificial intelligence which is being utilised for radiographs, which is obviously really important for us. We work with quite a lot of other members of the multidisciplinary team, physiotherapists, nursing staff, theatre staff, and I think through that it's definitely quite a team game, and that for me is something I really enjoy. I think most places I've worked, orthopaedics still has quite a firm-based setup, so you work for a consultant, you do what it is that they're doing, and I think that that's a really positive thing because you get some rapport, they get to know you, you get to know them, and you get really good training through that. And I personally have found orthopaedics to be a really friendly, welcoming bunch of people. Certainly here in the Northwest we have something called the 58 Society, which is an orthopaedic society where we all meet up about once a month, and we have some food and there's usually a talk. And I think across the breadth of orthopaedics there's lots of sort of work / social events which you can get involved with, which is a really positive thing. What are the drawbacks to this career path? So I think, as with many medical specialties, there's quite a bit of sacrifice involved. It can be a relatively competitive specialty, and so it's usually one that you have to know that you want to go into and plan accordingly. Certainly for me, because I started foundation knowing I wanted to do orthopaedics, I was able to hit the ground running and get my various audits and things I needed for core training and ST3. But that's not to say if you haven't decided by that stage you can't do it, but it's definitely something you need to put a little bit of thought into. And I suppose going hand in hand with that is the fact that you need to be quite organised to be on top of that. It can be quite a busy specialty and it can require quite a bit of hard work. It's a long training programme. We do have exit exams that you sit around SD6, and so it's a fairly long game that you're committing to. Requirements for the role. Certain personality traits that I think you'd need. So being organised, as we've alluded to, making sure that you can stay on top of all the various things that are required of you. Certainly for our CCT requirements, you've got to show that you've been involved in teaching, that you've been involved in research, that you've got your octave numbers, that you've engaged with ISCP. And if you're not an organised person, that can become quite stressful. I think as well it can be a relatively fast-paced specialty, and you tend to need to be somebody who can make a decision. Often in orthopaedics there isn't necessarily a right or a wrong answer, but it's just a case of making a decision that's sensible and that you can justify and go with it. And I'd say also you need to be a bit of a team player. As I've again said before, this is quite a team game. We work with radiologists, we work with physios, we work with members of the whole team, both within orthopaedics and outside, and you've got to be able to get along with people well in that regard. So how do you apply for the specialty? So the traditional training route is that you would do the foundation training programme, and once you've completed that, you're eligible to go into core surgical training. So that usually you apply in your foundation, but some people do have years out. And the core training programme is a 2-year training programme which you can do themed towards orthopaedics. So I did 18 months orthopaedics, 6 months plastics. And then at the end of your core training, you would apply for higher specialty training, which is SD3 through to SD8. That again is national selection, so you'd go to a national interview and you'd be placed for SD3 higher training. Most people following completion of their registrar training do a fellowship year, at least one, if not two, in their chosen subspecialty before taking on any kind of consultant post. In terms of training requirements, the best thing to do, because they often change, is to make sure that you're looking out for the person specifications, which are often available on the websites, and also they have the score sheets often available. So they will give you quite a clear breakdown of exactly what it is you need to have achieved, particularly in portfolio stations. It usually encompasses things like teaching, higher degrees if you have them, but I wouldn't say to worry too much if you don't. Making sure you've got involvement in audit, in research, often leadership roles are desirable as well. So it's about being a varied trainee and demonstrating how you can show certain attributes. The one bit of advice I would say is that everybody gets really worked up about portfolio and feeling that they need to have 10 publications, but actually when you take a step back, it's only a third of the interview portfolio. There is a clinical and a management section for both core training and for SD3 interviews, and so do what you can in terms of your portfolio, because it's a way to get money in the bank, to get points, but don't let it put you off if you feel that you haven't got a really superb CV, because you can make it up in other areas. If I were a medical student or a junior doctor now, would I choose the medical career pathway I've taken? Yes, I would. I really enjoy my job. As with anything, it has times where it's tough and that you feel there's quite a steep learning curve, or quite a lot of pressure on you to develop. But there's loads of added benefits as well. It's an incredibly rewarding specialty. You can really help people in orthopaedics. You can really make a big difference to their life and their ability to function, and I think that's massive. It's often a specialty where we have a problem and we can fix it, which often makes us the butt of jokes, but actually is a really rewarding element of this career path. And I would definitely encourage anybody who's interested in orthopaedics to give it a go. Any further advice I'd have, my advice particularly for people earlier on in their medical journey is to keep an open mind. I went to medical school thinking I would want to be a GP or a psychiatrist. I never ever considered surgery, and the only reason I fell into a surgical training pathway was because I was into sports and I wanted to do sports medicine, and I ended up in theatres, which in all honesty I'd probably tried to avoid before that, and actually found that I loved it. So keep an open mind. A lot of the stereotypes that you hear about all specialties are not entirely accurate, and orthopaedics is a career for everybody.